All right. Good afternoon, everybody. Yours truly, Dr. Barry Pierre, favorite board certified internist, founder of drbarrypierre.com, as well as the CEO of Pierre Medical Consulting, bringing you episode 72 of the Empower Yourself for Better Health series. This series is done live with talking about various topics. Unfortunately, because of the times we're living in right now, the last three episodes have really had to be dedicated to the coronavirus and COVID-19. So we are giving yet again another update on the coronavirus and COVID-19 and where we're at. And I get a lot of questions, just obviously being in a hospital position as far as, what we're doing and, what to expect, right? So I'm going to hopefully be able to answer all of their questions today. Like always, depending on where you're watching this at, because we do this live on not only Facebook. I think I'm on my Facebook page, my personal Facebook page, my business Facebook page. I'm in my group, as well as YouTube and Twitter, or Periscope. So if you have any questions, just post them in wherever you're watching this at, and I should be able to see it pop up on my screen here. So we're going to get to, really first and foremost, right, we are at 4 million cases at this point right now. And just to kind of give some perspective, right, just to give us perspective of the significance of us hitting 4 million. I just want to, I saw this tweet, CNN had actually posted it, and I thought it was like extremely disheartening, but also important as well too. So according to, I'm not gonna put it on the screen. According to Johns Hopkins University, we went from our first, very first case to 1 million cases here in the United States. And these are all United States numbers in 99 days. So it took us 99 days, right, for us to, which again, almost like 4 months, right, for us to go from 1 million, from 0 to 1 million cases. Unfortunately, we went from 1 million to 2 million cases in 43 days. We went from 2 million to 3 million in 28 days. And then for us to go from 3 million to 4 million, it only took us 15 days. Last time we actually talked, when we did this, I think episode 71 was actually, we were only at the 2 million. And we were talking about like, hey guys, we're at the 2 million mark. And 3 million came so fast, right, that I didn't even have time to do an updated video because nothing had really, again, 2 to 3 million a month, right? So nothing had really changed, for us to like really give an update, right? But again, the fact that we're up to 4 million in counting, which again is not surprising to many, right? Like again, if you've been watching us, especially if you listen to some experts, if you listen to me, we've been talking about this again since February, and we knew where the numbers were headed. If we were being conservative and kind of following, the directions at hand, right? Unfortunately, we did not follow the directions at hand, and of course, now you see this kind of inswell. So, first and foremost, I always tell people when you are looking up any health-related medical information, to always have your trusted sites to go to. And if for coronavirus, right, if you have one site to go to, right, if you had any site to go to, but just one, let's say, especially you don't want to listen to me, right, and you had to go to some site, I always say start with the CDC, right? That's the one site that I would always start with, kind of moving forward to say like, this is where I need to get my coronavirus related news, especially all over across the country, right? Of course, we'll touch on Florida cases in a minute, because again, obviously as a Florida physician, I really stay hard to, how Florida is doing. And let me just give you a hint. We are doing a very, very, very bad job. Lots of different reasons, which we can talk about, but again, lots of different reasons why we're not doing a good job there. So let's first of all, again, let's go to our CDC site again, just in case you're like, hey, I want to start learning more, I want to start reading more on, what. By this time, you should know what the coronavirus is. If you don't, you've been living under a rock, right? So you should at least have an idea of what the coronavirus case is. But again, let's go to our. Let's see. So first, again, I love to go to the CDC website. I'm a big fan of it. Why? Because, and again, I said this before, especially when it comes to health related news, I think a lot of us, don't become empowered because a lot of it can be very inundating. We see a lot of terms that kind of go over our heads, and the CDC does a great job at being able to really simplify a significant issue that we got at hand, right? So let me just widen the screen. Perfect. So again, right there, four. Again, when I posted this, which was like a few days ago, as far as like, hey, we're going to do another episode, right? We had just crossed the 4 million mark. As you can see, we are already at 4.3 million cases. Total deaths, 148,000. Now, this is yesterday. This isn't even the most updated version, because I can tell you, unfortunately, right now, we are over 150 deaths due to coronavirus. And unfortunately, again, there is more to come. Again, and this is just one where, again, I just like, again, let's you guys, especially if you caught my previous Empower Yourself Better Health series, you've caught this before, you've seen this graph before, you've seen, how this has changed, right? There's at one point, right, where, there's a lot of lightly colored states, but as we've kind of moved on, and again, this right here, like you could tell how old this is, right? Because look at what their graphs were initially going by, right? 40,000 was like a high mark for them. I am in Palm Beach County right now. Palm Beach County is about to cross 40,000. Dade County has almost 100. So just to give you an idea of where this kind of started with, as far as this graph is concerned. But as you can see, a lot of blue across the country. Florida, again, is, Florida is Florida. Again, we'll talk about that. California, New York, Pennsylvania, all of these places where there's just a lot of significant amount of cases here of COVID-19 and the coronavirus, and then deaths, obviously most important, right? Because I've seen some people, right, when, especially in social media, again, as a physician, you tend to see a lot of incorrect information in from the health perspective, right? So I saw a lot of people, I saw one, I think it was a tweet that someone said, well, as you can see, they're talking about the number of cases, but they are talking about the number of deaths, right? And one thing I've told people before, right, just so we can make sure we can kind of get a good grasp of what the COVID-19 coronavirus is, especially if we're comparing it to, let's say, the flu. The flu does kill people. Yes, it does kill people. Coronavirus obviously kills people. The problem with the significant issue with the coronavirus versus the flu, right, and why we are, so in depth of really trying to get everyone to kind of, protect themselves and protect everyone else, right, is that it's much more contagious than the flu, right? So that's why we get concerned. So again, you may not be concerned of a death rate that's, again, less than 1%, right? Like that may not move you very much. But the problem is, right, when over 4 million cases, when so many more people are going to get this virus, this number just has to go up, right? So that's why we were bigly concerned, right? Like, yeah, you could say like, oh, look, we've had over 4 million cases, and some people are like, well, there's only 150,000 deaths, right? Because again, it is over 150,000. But think about the fact that if one of this 150,000, right, was one of your loved ones, right, was one of your friends, one of your family members, right? So, I caution, especially on social media, really not to really use that argument of, well, it's not as deadly as, the quote unquote experts, people like me are actually saying. Yeah, I didn't tell you that, 50% of the people who get this virus are going to die. We're not saying that. We're saying that this number right here, the total number of cases, is going to be so high, right, that if we don't decrease the total number of cases, right, we're going to get a lot of deaths, right? That's all we said. And, we'll continue to say, right? So as you can see here, again, the same kind of our similar hotspots where, and again, this makes a little bit more sense, right? Again, over 5,000 reported deaths. And again, pretty much the same places: Florida, Texas, California, New York, Pennsylvania. You can just kind of see, even Massachusetts, you can kind of see those numbers. Michigan as well too. Unfortunately, again, these are deaths, right? Just the number of people who died secondary to the coronavirus. And again, and this is probably more indicative of, a failure of our system, right? This is probably more indicative of us really not being, as cautious as we should have been, right? And again, obviously around March 19th was kind of the first cases were reported, and you can kind of see a lot of the lockdown kind of happen here. So this time frame, again, from like March to like mid April, right? It was kind of the lockdown, and we figured like, oh, we can start opening up again, right? But what the hope and goal was when we would start opening up again, people would wear masks, people would social distance, and this is a perfect example of us not doing that, right? So as you can see, this curve is beginning to go right back up again, right? So, and those of you may be convinced that, well, oh, this is just the second wave of the coronavirus. And let me tell you, especially if you happen to catch my podcast episode with Velton, who is an epidemiologist, Velton Show, he talked about how this is not the second wave. All we did was kind of postpone the first wave. So this is all from here all the way up, because that's the trajectory it's going, is all first wave, right? So we have not, I repeat, we have not touched the first wave of, we have not finished the first wave of our COVID-19 cases. And of course, obviously, this is a number I take, a very keen eye on, right? The fact that we have healthcare workers, right? Remember the people who, when we were locked down, when everyone was kind of giving us our kudos and, everyone was giving us discounts everywhere and allowing us to shop early. Of course, that went away. But the people on the front lines, the healthcare personnel, right? Obviously the amount of cases are going to be higher, right? The amount of deaths, again, is definitely something to note. And again, as a program director and someone who has to take care of residents, right, is definitely something that I keep a keen eye on, right? Because again, my residents are on the front lines. I'm on the front lines. As a hospital physician, I've been taking care of, again, COVID patients, for as long as COVID's been around, or at least as long as we've been able to diagnose it at my hospital. I actually take care of the first COVID patient here in the hospital at Wellington Regional. So again, definitely concerning numbers, right? Definitely something that I keep an eye on week to week. And like I said, and I said this before, if you have only had one website to go to, right? One website, one source of information to look at, right? I think the CDC site is kind of where it's at. So let's stop streaming there. So just kind of touch base, right? So again, we are at 4 million cases right now, right? And clearly we're at 4 million cases at a rate that we did not expect, right? Big question I get is why? Why did we get to this point where, hold on a second. Yeah. Why did we get to this point where, 4 million cases kind of hawked us down? And, what do we have to look forward to? I can tell you a lot of it just has happened to do with, us really not being as aggressive and diligent as we needed to in the beginning, right? Like, again, we essentially shut down the community, shut down the country, right? And, put everyone on lockdown. And I think at that point, we were very like, all right, this is something we need to worry about. But as things started opening up, that next phase of wearing masks, that next phase of washing hands, social distancing as much as possible did not happen. That's just unfortunate. Like, I'm pretty sure if you're watching me right now, you have a friend or a family member, or you saw a video or picture of people partying, people going to the beach. You saw pictures of people, storming government buildings to be able to go back to work, or storm, and not even go back to work, but go back to work and then not wear a mask. So you've seen these pictures, you've seen these images, and now you're seeing the results, right? So again, as a public health professional, as well as a physician, none of this is unfortunately surprising to us. And again, I implore you to definitely catch that episode with Velton, right? None of these numbers, especially as bad as we're getting, right, is surprising to us, because we did not do anything to try to make sure this doesn't occur, right? Again, we've seen, especially in this country, and again, I talk to people in other countries. I talk to my VA. She's actually from the Philippines, and she talks about what's going on in like different countries, right? And our attitude towards the coronavirus COVID-19 is much different, right, than other people in other countries, right? Which is why you're able to see other countries, open up faster, kind of resume quote unquote normal life, because they took it serious when they need to take it. And unfortunately, we are as a country as a whole, right, we're seeing the unfortunate effects of us not doing so. So I do want to point to another site that I kind of frequent as well too. This is actually from New York Times, especially if you've gone to the CDC and you're like, yeah, I like the numbers, okay. This is another one as well too, kind of, especially if you really want to, like, for some reason want to keep up to date on the amount of cases. that's going on here. So again, this is on the New York Times. So, and like I said, the CDC site's usually behind like 24 to 48 hours. So again, coronavirus in the U.S., right? Latest map, right? So again, and you've seen this graph before, right? Like you've seen this, like what we thought was the flattening of the curve hit right back up again. As far as total number of cases, again, we've got over 4.4 million cases in county. Like I said, it took us, right? Again, let me get the tweet again. It took us 15 days, right, to go from 3 million to 4 million. And we are already at 4.4 million, right? So I can only imagine how long it's actually going to take us to get to 5 million, because we're going to get to 5 million. And again, I don't want to be hyperbolous, right? But I want, especially those in the lunch learning community, those who are watching this video, to really take heed that the coronavirus is here, it's alive, it's kicking, and we're unfortunately, not doing a good job at all whatsoever. And again, this I like, because they'll tell you, like, especially on a day-to-day basis, yesterday they had 1,400 new deaths, right? 14. And again, I don't want you to look at this number and say, oh, we got 4.4 million. That's a lot of people. Again, remember, just think about this. If this was your mom, this was your grandpa, this is someone's mom, this is someone's family members, right? Who counts towards this 151,000. Before you, again, I just don't want you to get on social media acting like this disease isn't deadly, because the amount of people who get it versus the amount of people who die, there's such a drastic difference. And this is another map that I love to see, right? Essentially, this one says, these are the hot spots, right? So these are the trouble areas. Again, I'm in Florida, right? So as you can see, not a good sight to see Florida on the map, but like, look at these other places: Georgia, Alabama, Mississippi, you have California, Texas is here, right? So again, and what I'll do is in the comment section, I will definitely post a link to all of this. But if you just do New York Times and coronavirus US cases, you'll get to this link as well. So, and again, let's just kind of look at the states, right? Let's just go to total cases here. All right, just so you can kind of get an idea of like what's happening across the country. And as you can see, we have a lot of people that's just going up, 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 up. Like, again, these curves, right, are going in the wrong direction, right? For those who were hoping to be vacationing, right, like, that's going to be wishful thinking, right? Because we, again, as a country, right, we are not doing a good job whatsoever, right? We're not doing a good job whatsoever in getting a hold of this disease, right? This disease is definitely, we're definitely losing the battle. Not to say that we're losing the war, like we're gonna, this is gonna, take us out of here. It's not, but we are definitely losing the intermediate battle right now with the coronavirus, because again, I think a lot of people aren't taking it, or did not, right? And again, I don't want to say aren't, right? Because maybe they, as I'm speaking, maybe they're now taking it serious, but they did not, right? When we wanted them and when we needed them to take it serious, right? And again, this is from top down, right? Again, you had government officials up to the president, right, telling us, masks were important and all these things here, essentially going against what all of the public health professionals and medical professionals were saying. You had people on the opposite side saying no. Right. Yet, like I saw the video, and again, I'm embarrassed. Right. It was in Palm Beach County here, where people were like arguing and like almost arguing tooth and nail with the county commissioners about how it was, against their rights to be able to, walk around without a mask. Right. Like, think about that. Right. Think about a disease process. Right. Again, if for those who may not know, again, the coronavirus is spread through the air. Droplet and through the air as talking, right? So think about a disease process where we're saying, like, guys, like, if you would just wear a mask, right, over your nose and your mouth, right, not only will you help stop the spread to other people, right, but then people could stop the spread to you, right? So imagine you hearing that phrase and then saying like, oh, it's against my rights to make me wear that mask. I'm not going to wear that mask. Right. Like, that's the mindset, unfortunately, with a lot of people in this country, that, they're just going to be defiant just to be defiant. Right. And you see, right, again, you see the proof is in the pudding. Right. There's no like, oh, it's not me. No. Yes. If you are one of these people who are, and again, let me get on you for a little bit. If you're one of these people who walk around here, don't think that the mask is important, or think that for some crazy reason, right, 4.4 million cases of this disease is a hoax, right? Like, if you're one of those people, there's really nothing I can do for you, right? Like, there's really not, especially at this point here, you're not going to be your mindset is likely not going to be changed, right? There's nothing we could do for you if at this point in time, 150,000 deaths later, 4.4 million confirmed cases, and I have to stress confirmed because we know there's a whole bunch more people. Like, again, if there's 4.4 million confirmed cases like right now, that tells me that there's probably closer to 10 million just walking around, right, who don't know that they have it, right? So just so we can kind of get the severity of kind of what's going on here. If you're one of those people that at this point still are like, nah, it's not, it's a fake, or I don't need to wear my mask and my civil liberties and all this like BS, you are likely going to be lost in the sauce, right? Like we're not going to convince you. And I've been imploring my health professional, especially my residents and my other physician colleagues, right? Those people, right? You're likely never going to change their mindset, right? Like, for example, if you're a racist, right? Nothing that, we do or say is likely going to, stop you from being racist, right? So you just stop talking to those people, right? You don't reason, right? You can't reason with people who are unreasonable, right? So we're not doing that, right? Like, we're washing our hands with that. All we can do is focus on, the task at hand, right? Like, how can we, get a hold of these, again, there's probably 10 million, but for now, we'll say 4.4 million. How can we get a hold of this disease that's really taken over our life? Mind you, in next week, right? In a week is be August, right? 8 months into the year. How many of you, right? Like, yeah, drop it in the comments, right? How many of you have had your whole year squashed, right, because of this coronavirus, right? How many of you had travel plans? How many of you had plans to, again, let's say not even out the country, right? You just wanted to go to a different state. Like, how many of you had plans to go to different conferences, had plans to do speaking, had plans to do all of these things that you can no longer do right now because of the pandemic that this virus has caused, right? Which, again, like, and that number is high, right? So in life, unfortunately, has to try to normalize, right? And again, we have to try to send people to work, right? We have to try to send people to school, which we're going to talk about in a second. But like, how do you do so, right? Like, that's the reality that, most of us are living, right? Again, if you're living in that reality that this virus is a hoax, that masks don't work, that, wearing a mask is against your civil liberties, you just stay over there, right? We can't help you. We're not going to try. We're in August. We're not trying anymore to help you, right? All we can do is focus on the people who don't know they have it. Because I gotta be honest, we don't know if you have it, or the people to prevent from having it, right? Like, that's all we can do from our standpoint. So I get a lot of questions, right? Especially, as the year is winding down, right? And people are trying to find some sense of normalcy. I get a lot of questions about, what about my kids, right? Like, because now in March, right, it was easy to essentially say, all right, school's closed, send everybody home, right? But now we're getting to August, September, when it was time to start sending kids back to school, right? And I'm getting a lot of questions about what should I do? First and foremost, right? What does the data tell us, right? Because that's the most important thing. Like, what does the studies and data tell us? The studies tell us that, and yes, first of all, before anyone hops in the comments, yes, we are fully aware that kids can pick up the coronavirus, right? Fully aware of it. But what we've seen, right, just from majority at hand, a majority of children will likely be more carriers of the disease than people who are actually inflicted with said disease, if you understand what that means, right? So if you're a carrier disease, again, you have these 4.4 million people with the disease. If you are a carrier disease, that means you got it, right? Like, I test you, I swab you, boom, it's positive, right? But it's not affecting you clinically. Like, clinically, you're not short of breath. Clinically, you're not, energy's down and out. Clinically, it's not affecting you, but it does affect you to the point where we're seeing. It does affect you to the point where it comes positive when we swab, right? So what do you do for that, right? So for kids, we have a lot of kids who are walking around. Oh, hold on, let me turn off this phone here so I don't be bothered by that. Sorry about that. So clinically, yes, kids can get the coronavirus. but we're not seeing a lot of symptoms affect the amount of kids who actually have it, right? So and the problem is, right? So what does that mean, right? If you're thinking about sending your kids to school, right, or sending them to summer camp, or those things are there, the likelihood that your kid is going to get sick, right, from said disease is much lower than if you were setting adult, right? Like, just so we can kind of get a picture again. Remember, the goal is always to simplify, so we're empowered, right? So it's going to be much more simplified, right? So again, the likelihood that your kid will get sick from a coronavirus is low, right? Not 0%, right? But we're not gonna say 0% because then y'all will be in my comments telling me like, hey, you said that the person my kid can never get coronavirus, now they got it. I'm not saying that. I'm just saying that the likelihood that they'll get a coronavirus and become sick from it is low. But the problem is, and for those, especially for parents out there, right, or people who just take care of kids, you know that your kids bring home illnesses all the time, right? I know in my house, when one of my twins starts catching a runny nose, right, then they give it to the other twin, right, then they give it to the oldest sister, and then my wife gets it, then I get it, right? Like that's what happens, right? That was happening before the coronavirus, right? So imagine that situation now. So imagine a situation where, the kid, again, picks up coronavirus, again, doesn't do anything to them, but they're gonna come home, they're gonna kiss you, they're gonna be all over you, coughing and sneezing in your face, because that's what kids do, right? And then they give it to another sibling, and then they give it to another sibling, and then it eventually comes to you. All of a sudden, you, right, the adult, becomes sick, right, from something that the kid gave you. Kid don't even realize they gave it to you, right? As the kids don't have any symptoms whatsoever, right? And that's my concern for the teachers, right? So when I hear that they want to like open up schools again, yes, I'm worried about the parents, but I'm really worried about the teachers who have to deal with 5, 10, 15, 20 kids, right? It's coming from different backgrounds, right? And they're coming to them, right? So like, what are we doing about the teachers, right? What are we doing about the support staff, the environmental service workers, the cafeteria, the principals, administrators, all these people at the schools that we're sending our kids to, right? Like, that's my main concern. Now, am I saying don't send your kids to school? No, I'm not gonna say that, because there's a lot of positive, again, there's a lot of positive benefits for sending your kids to school, right? Just more social interaction, being around kids, especially if your kid's been locked up. My kid's been locked up in the house pretty much for the past 3 or 4 months, right? So, just getting them around other kids does them wonders, right? So I'm not saying you shouldn't send them to school, or you shouldn't be fearful of school. I'm not saying that. I'm just saying that, the risk that's being posed isn't necessarily on the kids, but it's on the adults around the kids, right? It's on the teachers. So again, I already know that if I got send my kids to school, because the decision, I'm not sure what the date is that they're deciding. If I got to send my kids to school, I'm definitely going to make sure, like, I send them with so the teacher. I'm gonna send the teacher a box of masks, right, and gloves and everything else, right. I'm gonna have to look out for a teacher, because I know the risk that teacher is being put in, right, really forced into, because again, unfortunately, society, business, again, business has to go, right. Like, that's our country, right, especially when the lockdown was happening, decided that business, right, had to take precedence over health, right? It was the reason why, the lockdown ended, right? Lockdown didn't end, even though those graphs may show you that it was getting better. The lockdown didn't end because we had a good idea of what to do with the coronavirus, right? The lockdown ended, right, because it was so greatly affecting the businesses, right, that this country was going to go run amok, right? Like, that's why the lockdown ended, right? Just so for those who may not be aware of why the lockdown actually ended, right? It wasn't health-related policy news that we're, people like the experts like us were saying, like, oh, it's okay, open up again, we're fine. That wasn't the reason why. It was just big business said, hey, we need to open up, and that's what happened, right? Just, honestly and truly. So that's kind of where we're at, right? So again, if you had to send your kids to school, it's, again, as far, especially if we're thinking about just the kids, your kids are likely going to be safe to go to school, right? You just got to worry about the kids' teachers, right? The kids' cafeteria worker, right? The principal, the administrator. You got to worry about them folks, right? So if you guys send them to school, if you can, right, send an extra box of masks or gloves or anything you can, because they're going to be the ones I'm much more concerned about, getting ill, right? And again, and obviously the parents too, right? Because again, we already know how kids do, right? Kids going to play together. They're going to they're gonna fight, they're gonna cough, they're gonna sneeze, they're not gonna really wash their hands as well as they should, right? And then they're gonna bring you something, right? So you may have to when you are picking your kids up from school, again, when I go home, I go through the garage. I gotta take out my scrub clothes. I gotta spray with Lysol. I gotta spray my shoes. I gotta do all of this, this production before I walk into my house. But that's because again, I take care of patients with the virus on a daily basis, right? In fact, let me show you my little suit here. Not suit, but my mask. So I have a respirator mask that I take care of patients with on a daily basis, as well as, and I got a couple of variety of face shields. I got this big face shield here, and I also got, if I could catch it, I also got these goggles as well. So, and actually, my chief resident. So I got these goggles that are like insulated around. So like nothing gets up top, nothing gets on the bottom, right? This is again when like I said, I know right now, they're not talking much about the healthcare workers, right? We've kind of fallen out of that highlight that we were getting in March, right? But like this is what we wearing on the front lines, right? This is the frontline workers. This is what we got to do, right? Just to kind of give you an idea, right? And again, not to say you can't wear this mask, right? This mask is important. This mask will help, slow down the transmission, the transmission, right, to others. But again, when I gown up and I got to go see a patient who I know has the COVID virus, right? That's how I have to go. So speaking of that, right? And last but not least, right? Like a lot of questions I get. This question I get all the time, right? So I'm gonna put another site up that I think you should look at, because especially for those who are always wondering, right? What about vaccines, right? Like this is have been. It's almost a very comical question, right? And I'm gonna talk about it why. But this has been a very, very important question. People want to know. People want to know, like, hey, what about the vaccines? What about vaccines? What about vaccines, right? So just to give it in general, right? What typically happens, right, when we're doing vaccines for anything, right? What typically happens with vaccines is, you got these trials that go on. These test subjects are usually in animals, and then it kind of slowly moves through the transition of like, okay, go from animals then to humans, and then if it works well in that subset of humans, okay, now let's give it to the world, right? That's typically occurs. Now, what most of you have probably read, right? Because I get this question a lot. What most of you have probably read is like, oh, I heard it takes like a year or two to get vaccines. How are they able to get vaccines out as quickly as they're saying, right? We're going to talk about, as quickly as they want to say, right? For the majority of time, right? Especially when a drug company is thinking about doing a vaccine, majority of the time, the vaccine takes that long simply because, it costs money, right, to do said vaccine, right? But of course, when you have a virus, when you have a pandemic that essentially shut down the whole world and is shutting down the world, I mean, especially in the United States, right? It's when you have a virus that can shut down the world, you're going to get a lot more players in the background to try to get a virus out sooner than later. So you're seeing a lot more money put into these companies than you would normally see in the past. And that's why they're talking about, vaccines a lot more and a lot quicker, right? And a lot quicker, well, I want to preference that, right? Because a lot of people think that, we're going to get a vaccine out and, by Christmas or Thanksgiving time. And first of all, let me tell you, Thanksgiving time, coronavirus is still going to be here. Christmas time, coronavirus is still going to be here. Next Christmas, coronavirus is still going to be here, right? Just so, and again, and the reason why I stress that, right? Because I don't want people to think that this coronavirus is like going away, right? Like I want to make sure. Like that's the case, right? Like it ain't. This is the goal at hand, right? So as we deal with this reality that we're in, right? That coronavirus is going to be here to stay. We have to deal with the reality, like, hey, is there some treatment for it? Now, again, me, right, being the public health physician, right? I find it kind of comical. Right. And I hate to say comical, but it's got to be comical, right? How many people are really clamoring, right, for a vaccine, right? Like, oh, when's the vaccine coming? When's the vaccine coming? When's the vaccine coming? And the reason why I find it comical is because we have a virus that affects us every single year, that kills people every single year, that we have a vaccine for, and I can only get 40% of the people, right, to do that vaccine, right? And I'm talking about, and those who, if this isn't your first time watching me, you know I'm a big proponent of the flu vaccine, right? So we have a vaccine already, that could save a lot of lives, right? If 90 to 100% of people take it, but they don't, right? So I find it comical that a lot of people are like clamoring for this vaccine, right? They're like, oh, no, I need the coronavirus vaccine. I can't wait to take it, right? Like you have a lot of people who can't, who will say they can't wait to take this vaccine, right? So let's, this website is actually another good one that I like, right? This is a nice little, is a vaccine tracker, right? So you're going to see how much work in the background is happening, right? For people to try to get a vaccine out there, right? So let's go to that site there. So this site is off the Guardian, and you could literally, if you just did the Guardian, vaccine tracker, you'll pull this up right here, right? So just to kind of give you an idea, right? So look at this, like more than 140 team of researchers are racing. They're racing to develop a safe and effective coronavirus vaccine, right? So we got to talk about health, and we're going to talk about some business purposes, right? From a health related standpoint, you have a lot of companies who understand the importance of creating a vaccine, creating it fast, but also creating it safely. From a business perspective, you have a lot of companies who realize, if I'm one of the first people to create my vaccine and it's safe and I can get it out to enough people, I am going to make a lot of money, right? So look, just to kind of give you an idea of, again, these are just the number of trials, that really haven't started yet. Again, preclinical, again, vaccines not yet in human trials yet, right? Again, 17 of them. And these are the different stages of trials. Again, like I said, we're not here to educate you on, vaccination trials, because that's not what this is for. This is more just for you guys to kind of get a visual picture, because that's always my goal. How can I get a visual picture for you guys, right? This is a visual picture of, where are we at as far as vaccines are concerned, and what does this mean for a timetable standpoint? So again, we have about 142 in the preclinical stage. That means they haven't even started it yet. Phase 1, 17 of them. Phase 2, again, expanded again. And these, again, they start small and they get bigger and bigger. Again, we have five current trials in the phase 3, right? So this is, as you can see, right, again, you can just look at it, is in the last stage before, right, it gets approved for the masses. So you got 5 concurrent trials happening right now as we speak. I'm in Palm Beach County. And I know one of the physicians here at our hospital is actually like the principal investigator for the vaccination trial here in Palm Beach County, right? So it's happening, right? But as you can see, this important number, the green category, right, is 0, right? So you have 0 ones who have actually been approved. So it is definitely happened as far as people. Let me see. Perfect. Yeah, it's definitely. Oh, that's too funny. It is. I'm just reading it. I'm actually reading the text message from our guest Velton show, again, the epidemiologist I was talking to about. Oh, that's too funny about that. So we're just talking about the virus as well too. So as you can see, 0 trials of 0 vaccinations have been approved to go out to the masses, right? And trust me, I can tell you, when we get the first one to be approved, I can sure you're going to hear about it, right? Because one, that company is going to make a whole bunch of money, and 2, most importantly, that people, I think, will be kind of lining up in droves to take said vaccine, right? So this is kind of where we're at. Like I said, this is on the Guardian, again, coronavirus vaccine tracker. So the obvious question, right? Obvious question you may have, right, is, well, Dr. Barry, all right, so this let's say that category turns to 1, right? Boom. Now you got one of these vaccine trials are approved, right? How safe is it? You know what? I don't know, right? Like, it's, again, you've got to go through 3 separate phase trials, especially from a safety concern, before it gets approved, right? So you got to go to there's people in this country who are in trials now, getting what is believed to be a coronavirus vaccine, right? Yeah. The number and the data isn't out yet, right, as far as the safety concerns and risk. But again, like I said, I'm more interested to see who's going to take this vaccination. vaccine when it comes out. I'm more interested to see how many take it, especially when I compare it to the flu, right? Because, and again, I've talked about this before. If you think, this wave, right, is the quote unquote second wave, wait till flu. Like, we were very fortunate enough, and I decided to say this, we were very fortunate enough that the coronavirus really took off while the flu vaccine was like heading down, right? We are very fortunate that that did not happen at the same time. Unfortunately, flu season's coming, right? And with the coronavirus, again, you see the graphs. Again, I don't have to conjecture, right? You see the graphs, right? With the fact that the virus cases are going up, right? And it doesn't seem to be like turning that corner yet. I think it'll be very interesting to see what happens when the flu comes around, because as a hospital physician, we had enough trouble when it was flu season, dealing with the cases that we're dealing with, pneumonia, flu, and people being on respirators. And we had enough issues with that. So now when I factor in the fact that now I'm going to have to deal with patients who have the flu, as well as patients who have the coronavirus, it may be a recipe. Again, I don't want to say disaster, right? I don't want to be hyperbolous with this, right? But like that's a very, very strong concern for us right now, as hospital doctors, right? As hospital administrators, and really just public professionals, right? We are very concerned to see what's going to occur when the flu comes around, right? Because if again, you may see that, you may not see that curve, take a dip for a while, right? And it's because from a timing standpoint, the flu is going to hit around that same time frame. So definitely, again, lots of stuff to be concerned about. Again, would I take the vaccine? I'm not sure, right? And the reason why, and again, this is more historical information, right? What typically happens is we typically get a low percentage of African Americans, right, who partake in the trials, right? We typically have a low percentage of African Americans, right? Especially African American males, right, who partake in these trials, right? Lots of different reasons. Majority of them is due to racism, and not even real racism now, but even racism in the past, right? Again, think Tuskegee, right? Think Henrietta Lacks, like think about like that, right? So we remember, what they did to us, right? Our population, right? These medical trials, right? And again, I've said this before. There's a lot of racial issues and concerns in medicine, just like there's, as you can see, obviously plenty in the legal judicial system, just like there's plenty in the housing. Like this, racism is here, right? So there's of course racism would be in medicine as well too. And check that podcast episode out with Dr. Patrina Crane. We had a great discussion on that. As well as the following episode, I think it was episode 154, 155, with Dr. Kat Ogle as well too. So a lot of discussions as far as racism is concerned and how it affects medicine. So I'm going to be very interested to see once they do, have an approved vaccine, what those numbers, right? Like how many people of African American descent, right, were in these trials, right? And can I, right, really, and confidently say like, all right, this should also work for this subset population, right? So that's again. So right now I'm on a wait and see basis as far as that vaccine is concerned. Just like you should be on a wait and see basis. If you have the opportunity, right, to get the vaccination, and you feel confident you want to do it, just go ahead, do what you have to do. But again, right now I'm on wait and see, and I can't necessarily recommend it one way or the other. So that's hold on a second. Let's see. Interesting. So that's kind of where it's at right now, right? Again, it sucks that I have to, instead of dropping the 3 million cases more, that I had to do this 4 million, but that's how quickly it's coming. And again, we're already at, as I'm talking about, 4 million cases, right? We're already at 4.4. I can only imagine how quickly we're going to get to 5 million, right? And I may not be able to do a 5 million one because it may come so quickly, right, that I don't have anything new to talk about, right? So if something new happens, something, vaccination, vaccine pops up out of nowhere, right? We'll definitely make sure we address that here with the Pirates of Better Health series. But thank you guys for checking in wherever you're checking in from, whether it be Facebook pages, whether it be my Lunch and Learn group, whether it be Twitter, YouTube, wherever you're checking in at. Appreciate the support. Again, like always, if you have any questions, any concerns, feel free to reach out to me. And I do want to shout out one of my community members. As you can see across the screen, in my Lunch and Learn community, you can join the email listing to get really up-to-date information. So shout out to Elizabeth for really promoting and sharing the episode. Give a personal shout out. I did a little challenge in my email list to say, like, hey, if you share it out to enough of your friends, I'll give you a shout out here, right? So she did that, so she got the shout out. You guys have a great day. Like I said, wear your mask, stay safe. That's really what you can do right now, right? Like, again, it's we're living, unfortunately, in a time where this coronavirus is going to be here to stay, right? And I think we need to accept the fact that this coronavirus is going to be here to stay, and then really have to adjust for that, right? We have to adjust for the fact that coronavirus ain't going nowhere. So you guys be blessed. Have a great day. Like I said, I'm talking about 40 minutes. Again, any comments, any concerns, drop it in the comments. Again, I will peruse my social media later on today. So if you have any questions, you can hit it up in there, and I'll try to answer them. Be blessed. Have a great day.